The second segment we're going to talk about today is part of the May month of awareness of events is National Stroke Awareness Month. And there's nothing more devastating for any human being or family to go through than having a member suffer a debilitating stroke, especially when the strokes can lead to loss of motor control, loss of regular function of life, and more importantly, loss of any thought process. Fortunately, there are certain great institutions of stroke rehabilitation that are existing, and we all have got to a point now where we can diagnose these things earlier through CAT scans, MRIs, and clot preventing drugs to help reduce the sequela, that is the outcome in terms of events. And secondly, real importantly, is a lot of times strokes occur, but the body and mind can be resuscitated at a certain point if you really go after and work hard at it. So the physical rehabilitation and mental rehabilitation 6 months after a stroke can often lead to dramatic improvement. That's the good news. So basically, what are the signs and symptoms of a stroke occurring? First of all, a cardiologist back in the formerly maybe 10, 20 years ago used to say your blood pressure should be kept under 120 or 130 over 90. That has completely changed. Blood pressures now should be, in their view, should be kept around 120 to over 70. 120, the higher number, represents systolic. That's the pumping coming out. Diastolic is your heart pump. And both of those numbers are important. So we won't get into the physician-related terms to that, but keeping your pressure down as low as possible is important. So taking your blood pressure regularly is important. How do we prevent some of these strokes from occurring? We went through this in our last talk about making sure your blood pressure is as low as possible. And the awareness things occur when a stroke starts occurring. There'll be slurred speech. You start seeing a facial drooping. You may see the eyelid or eye sort of drooping. A person experiencing will have a sudden loss of strength in either their arm or their leg. They'll be confused. They may have a severe headache, and they may have syncope or passing out. Any of those signs and symptoms mandate that we get to the nearest emergency room department, so that time is brain, time is heart, time is money. The quicker a physician and their team can get to doing the lowering of blood pressure, the thrombolytic drugs that may be needed, and this, the better off your chances are, the less of the stroke occurs. So it is very important to look at, a human being and know what to do, particularly if they're having any of these signs and symptoms, and most importantly, be in safety to get to an ER as quickly as possible. And for those of you that have had an unfortunate event of experiencing, there is rehabilitation, both through speech and physical rehab, that you can get back to 100% mentally in a lot of instances, and hopefully 70, 80, 90% of what you were doing. So again, medicine's come a long way, but prevention of this through high blood pressure and maintenance, and taking on your meds if you're diagnosed with high blood pressure, losing weight, 5 pounds, 10 pounds will probably lower your blood pressure 2 millimeters diastolic. So again, all these things are helpful, and I hope that we recognize the importance of health. So laugh every day, take your medicines, eat properly, exercise, and get enough sleep, because sleep also can be a wonderful reducer of blood pressure. Thank you.